I'm David Lombardo, and this is WCNY's The Capitol Press Room. In June, state lawmakers overwhelmingly signed off on legislation that would have New York join other jurisdictions that participate in the Psychology Interjurisdictional Compact, which includes almost the entire country at this point, and would enable out-of-state providers to offer services to New York-based residents, especially those New Yorkers in need of specialized care. Additionally, it would let New Yorkers who move out of the state continue to access their existing providers remotely. To talk about the measure, we're joined remotely by Dr. Francis Lee, chair of the psychiatry department at Weill Cornell Medicine. Well, from your perspective, what are the shortcomings with the status quo as it pertains to the delivery of mental health services that could be addressed by entering into the Psychology Interstate Jurisdictional Compact?
So first of all, I'll just start by saying I'm fully supportive of this compact, especially in this time when there is a youth mental health crisis and also a mental health crisis among all populations. But I would say that the most vulnerable are young people as well as older adults. And just to give you an example, if someone is seeing a psychologist in New York State and then goes to college in another state, they will have to find a new therapist and will not be able to have continuity of care. And I'm very much concerned about, especially this population. And I think the state, New York State, has also leaned into heavily of how do we address the youth mental health crisis. And this, I think, is a great way to do so, so that if you are seeing someone right now and you go to college or you have to go away for a couple months during the summer for a job, then you will be able to continue to see your therapist by telehealth, throughout that time, and there's no disruption in your care. In the past, either you went without seeing you're continuing your therapy, or you would have to get a new therapist. Yeah.
If that's the concern, though, why not just authorize those existing relationships to continue? Why do something this expansive? Is it a all or nothing proposition, or could we have just authorized those existing relationships to continue and not necessarily allowed people to create new relationships with New York providers when they're living out of state?
Licensure for different states are different for each state. And I think this type of sort of comprehensive compact allows this to happen sort of seamlessly. I think so in many ways, there could have been many, just to give you an example, lots of our providers have multiple licenses for other states, mainly in New Jersey and Connecticut, just because lots of our patients work in New York State but live across the border in other states. And it's just the complexity of trying to basically make these one-off agreements with each state is going to be very complicated. And I think this one, in one fell swoop, takes care of this. And as you noted in the very beginning, already 42 states have signed on to this type of agreement, for this PSI-Pact. So I think that it suggests that this is an idea that has already sort of gained significant traction across the country. Yeah.
And in practice, if this is signed into law, we join the compact, how do differences get resolved? Say, differences between what we expect for licensing standards or training or scope of practice for practitioners in New York, and maybe what's allowed in other states where they might have a broader scope of practice or aren't required to meet the same training standards? Are they going to have to follow New York's rules and regulations if they're treating New York patients?
The way it's currently constructed is that if, for example, just to give a real life example, if a psychologist in New York State wants to treat a patient in Connecticut, then they will just have to basically fulfill some modest requirements of the Connecticut licensure requirements, but nothing compared to the sort of the significant amount of paperwork it would have taken to get a Connecticut license. So I think there's still some checks and balances, but the bureaucratic load is significantly lifted to get these types of arrangements. And that just for those that are concerned that if you have an outside therapist from outside of New York State coming in, that they would also have to fulfill certain requirements for New York State licensure, not the full licensure, but that there are certain requirements that have to also be met. Again, this is just to make sure we ensure quality control, et cetera. But the paperwork will be significantly less. That's an upside.
Well, I want to talk more about the idea of those out-of-state practitioners serving New York residents because during that floor debate, one of the Republicans who voted no said that the practitioners in New York have a more limited scope of practice and pointed to something like their ability to prescribe drugs being different than what might be available in other states. So when there is that sort of broader scope of practice in other states, will a New York patient get the benefit of a broader scope of practice, or will that practitioner have to have more of a narrow and more curtailed scope that would be what they would have to follow if they were in New York?
I would say that the main distinction is that this is a compact that is for psychologists. So
Mhm.
psychologists provide psychotherapy, but they do not prescribe drugs. So essentially, that's the realm of psychiatrists,
So
right?
on
So
the floor debate, you're saying the assembly member who referred to psychologists in other states
yeah.
potentially prescribing drugs, he was mistaken?
Psychologists cannot prescribe drugs. Only
Gotcha.
psychiatrists and nurse practitioners, and those are not part of this compact. This is mainly about psychotherapy and mainly of the psychotherapy. And therapists could potentially go practice for a very limited period of time in another state, for example. But I would just like to make the point, though, that psychotherapy is quite unique in terms of the various types of interventions we have in medicine. And it's really clear, and there's data for this, that individual preference and for one's therapist will not only enhance treatment engagement, but also potentially positive outcomes. So you can imagine having to switch psychotherapists during a summer break or during college is really disruptive. And to give you another example, we have patients that do come in to see us in our offices, but sometimes it's inconvenient. And if they happen to work in New York but live in Connecticut, to be able to have some telepsychiatry or telepsychotherapy treatments while they're at home in another state, it will just enhance the sort of the ability to have seamless continuity of care. It's sort of like the way that during the pandemic, when we first started really using telehealth as a way of delivering care, we found that this was one of the most effective ways to basically deliver care, especially to those that had difficulty to get access to our facilities, especially during the pandemic. But it's become clear that this has become sort of a standard within our field.
Well, before we move on, let me reintroduce you. For listeners just joining us, I'm David Lombardo, and this is WCNY's The Capitol Press Room, and we're speaking with Dr. Francis Lee, chair of the psychiatry department at Weill Cornell Medicine. In addition to those New Yorkers who are out of state temporarily or permanently, the case was made that this is going to expand the pool of providers for those New Yorkers who maybe can't access a psychologist in a timely fashion or maybe not finding the right one that they need. Does this sort of underscore the need for more psychologists in New York more broadly as well?
I think this underscores that we will always have that there will always not be enough psychotherapists in for all the patient population. I mean, if you think about the prevalence rate of anxiety and depression, which is possibly 20% of the population, and that but by being able to serve all our patients in this way, this I think would be something that would hopefully expand access, and especially for those, for example, working families that are trying to basically that work in New York State, but then live somewhere else, and then to be able to have a telehealth visit in the evening and not have to travel to an office to see that provider is it just allows these types of treatments to happen that would not have been able to happen, even like several years ago. Also, not to tout how great we are in New York State, but we have some of the best specialists in child and adolescent psychology as well as geriatric psychology. So you can imagine that if they go to another state, they will not be able to find someone of equal level or quality. And I'm being biased about New York State, but I'm just saying that it's not clear that all states will have the same level of expertise, and to be able to provide that to the highly specialized care that we can provide, and especially to, as you say, to underserved populations in particular.
Although that difference in licensing and expertise is something that's actually underscored by the groups that oppose this legislation, who argue that you might be opening the door to a lower quality of care and potentially creating maybe a two-tiered system where those with the best insurance or the best ability to pay out of pocket will be able to still access those high quality, well trained New York practitioners, while others might be relegated elsewhere.
I would say that that's probably a concern that might exist, but that right now, given the fact that we have sort of a youth mental health crisis and a general need for mental health services, that we need all hands on deck. There are still going to be sort of safeguards for people that out of state practitioners that have to fill certain requirements. And I also would say that our marketplace will also determine who the best therapists are. Our psychologists will be able to still be able to be able to provide as many of these services to our population.
Well, finally, this compact, if New York enters it, would be the first of its kind that New York has entered into. Do you think there are opportunities for other cross-border shared practitioner opportunities, or do you think this is a unique field and we should consider this a one-off?
I'm a believer that we should try to expand access, especially for behavioral health services, as best as possible. We should proceed with this. And I hope this is not just a one-off, but I will also say that we also want to be, as we roll this out, make sure that we do everything carefully enough so that we ensure that we have the highest quality, as you said, of care for all our patients in New York State.
Well, we've been speaking with Dr. Francis Lee. He's the chair of the psychiatry department at Weill Cornell Medicine. Dr. Lee, thank you so much for making the time. I really appreciate it.
Thank you so much.
And one point of clarification from our conversation, according to the American Psychological Association, there are a handful of states where psychologists, under limited circumstances, can prescribe prescription drugs. Support for the Capitol Press Room comes from O'Donnell and Associates, a public affairs firm providing strategic guidance to businesses and nonprofits on navigating policy and regulatory issues. More information is available at o'donnellsolutions.com.